Hello everyone, today we'll be studying about the ethics, so let's begin with the definition. Ethics is the philosophy of the human conduct, a way of stating and evaluating the principle by which the problem of the behavior can be solved. The ethical principles include to do no harm, to do good, respect for the persons, justice, veracity or the truthfulness and confidentiality. First, to do no harm. To do no harm is the foundation of the social morality. The iatrogenic disease is the name we give to the doctor-induced illness, and all of us in the dental field have seen the overhanging restoration that causes the periodontal disease or the failure to sterilize the instrument can cause the infection. The next is to do good. The expectation of the patient is that the care provider will initiate the beneficial action and there is an agreement between the doctor and the patient that some good will result. The process of treating the patient, what has to be weighted are the consequences of the treatment versus no treatment. For example, in treating the questionable dental caries, it is not enough to say that it will not harm the patient. The point to be noted is whether it is of any good to the patient. Attempts should be to maximize the benefit and minimize the harm. The second is respect for the person. It includes the two fundamental ethical consideration is the autonomy and the informed consent. Autonomy is a principle that dictates that the healthcare professional respect the patient's right to make decisions concerning the treatment plan. An autonomous person is an individual capable of deliberation about the personal goals and acting under the direction of such deliberation. Informed consent. The informed consent is an essential component of a patient's right to autonomy. The consent must be voluntary, legally competent, informed and comprehending. The informed consent consists of a description of the procedure to be carried out, description of any reasonably foreseeable risks or discomforts to the subject, a description of any benefits to the subject or to others which may reasonably be expected from the treatment, a disclosure of the appropriate alternative procedure or course of the treatment, if any, that might be advantageous to the subject. A statement describing the extent, if any, to which confidentiality of the records identifying the subject will be maintained. The statement that the patient has understood the procedure and is willing to undergo the treatment. The signature of the patient and of a witness. The next is justice. Justice is often described as the fairness or the equal treatment. The primary duty of the health professional is service irrespective of the class, creed, etc. The justice demands that each person to be treated equally. The dentist can provide some of the free or discounted care in their offices to those who are truly needy, or they can provide the financial support to donate some time to clinics for the low-income patients. Next is truthfulness. The patient-doctor relationship is based on the trust. Lying shows the disrespect to the patient and threatens the relationship. The dentist may feel that it would be better if the patient took certain course of action and therefore manipulates the information that is given to the patient. Whatever the reason, the relationship will ultimately suffer and the dentist will be guilty of transgressing a major ethical principle. The next is confidentiality. Patients have the right to expect that all the communications and the records pertaining to their care will be treated as confidential. It is very natural to want to gossip about the patient, particularly if someone is famous or possibly a neighbor. But to do so would break a bond of the trust between the dental professionals and the patients. Earlier, it was widely accepted that the confidentiality could be breached if it was thought it would benefit the patient. However, the knowledge of a patient gained in the course of the examination or the treatment is privileged and should not be disclosed without the consent of the patient or an order from the presiding judge in a